Hello, this is Joe Trahan, welcoming you to the All Me podcast from the Taylor Hooten Foundation, whose mission is to enlighten the world to the truths about appearance and performance-enhancing substances. As the national leader on this subject, they communicate their educational messages through various methods, including this podcast. Thank you for listening and enjoy the show.
Welcome back to the All Me podcast. This is Don Hooten Jr., and today I'll be your host. We're back today with the second part of our interview with Dr. Thomas O'Connor, the Anabolic Doc. If you haven't had a chance to listen to part one of this multi-part episode, be sure to go back and listen so that you have some reference as to the topics we're discussing. In this episode, the Anabolic Doc is going to break down anabolic androgenic steroids, dihydrotestosterone or DHT, testosterone, and others. Not only is he going to give us a full history of why these drugs were designed, but how they're being used in modern medicine, as well as the side effects that can come along with abusing these drugs. One of the most important muscles in our body that can be affected when using anabolic steroids is our heart and cardiovascular system. Dr. O'Connor is going to give us a ton of information as to how these drugs affect the heart and why educating people is so very important to him and his work. Education and awareness is something Dr. O'Connor is passionate about, so he puts a lot of great content out on YouTube. You can find his channel by searching The Anabolic Doc. Just a disclaimer about our interviews. The content in this podcast represents the opinion and knowledge of our guests. This podcast should not be used in any legal capacity whatsoever, including but not limited to establishing a standard of care in a legal sense or a basis for expert witness testimony. No guarantee is given regarding to the accuracy of any statements or opinions made on this podcast. The content should not be taken as medical advice and is for information purposes only. Should you have any medical questions, please consult your healthcare professional. We appreciate all of your support and would ask that you hit subscribe so that you don't miss another episode. Please be sure to leave us some feedback so we know how we're doing. We'd also ask that you consider making a donation to the Taylor Hooten Foundation to help support our education programs and our mission to enlighten the world to the truths about appearance and performance-enhancing substances. Now let's get back with Dr. Thomas O'Connor, the Anabolic Doc. All right, Dr. O'Connor, we're back today, and I want to pick up our conversation and talk about anabolic steroids and testosterone. Can you start by telling us what are they and why were they designed by medical professionals?
Boy, so that goes back in the history book. So anabolic steroids, well, testosterone is the base. You know, testosterone is really fundamentally the first quote-unquote anabolic steroid in the world. It's a natural anabolic steroid produced mainly from a man's testicle, and it goes back to 1930s in Germany, where they knew something was going on, making men. You know, this is you're looking 1880s and times like this, and turn of the century 1900. They realized there was some androgynous hormone. I mean, these are kind of going back then. I mean, these weren't words that were really formed medically in the scientific community. But they knew there was something that made men versus women. And they knew that, I think, for hundreds and hundreds of years. And then they finally, I think it was 1933, they were, with crude forms, organic chemistry, they finally crystallized and selected and discovered really the first gram of crystalline powdered testosterone. And it was from, I think, 150 liters of policemen and firemen's urine. Literally, that's how they did it. So that was the beginning. And then at that point, they obtained pharmaceutical grade, testosterone in an isolated chemical form. And from there, Don, it is history. They started realizing how they can administer it, and with all the biochemical limitations at that time, or a pill form, it's readily disintegrated, and it doesn't readily form. You can't just take testosterone in a pill form, and now things are different now because they've made different bases and things. So they pretty quickly realized they can make it into solutions, aqueous, water-based solutions, and then very quickly they realized they can make it into an oil basis over 20 years. Now, from that point, they realized, I'm just giving you a summary. From that point, because I love the history, on my my YouTube channel, I present every classic anabolic steroid, including history, clinical presentations and applications and all the underground stuff, as I've been involved with this for over 20 years. And even personally, I'm 55 in the 80s and 90s before it was anything like it is today. And, so if you look at the testosterone types, the chemists and the scientists realized there were side effects. And they started understanding the anabolic versus the androgenic properties. So when you hear anabolic androgenic steroids, right? AAS. So you think, what is that? Anabolism, anabolic versus androgenicity. So that anabolic is muscle building.
Okay.
They're muscle building. Okay. That's just protein synthesis, nothing more. There's different anabolic, insulin's anabolic, but androgenic steroid denotes a very specific class of drugs, obviously steroids. And they realized that they wanted to, the best case was testosterone in the 60s. In the 50s, Dr. Ziegler realized, remember the Dr. Ziegler story? He realized that the Russians were taking intramuscular testosterone for sporting. And it wasn't nothing illegal. It was just, imagine you could use something and you could just, do better. It wasn't seen as illegal, 1950s. And they supposedly had BPH, which I don't believe it, because young men, they take tons of testosterone. They don't get prostate enlargement because they're too young. Okay. But he came up with that. That was the cited reason. He went to the drawing board with huge pharmaceutical companies, and he created Dianabol. Then so at that time, they came up with, and because they wanted to limit the androgenic, they wanted to make it more anabolic and less androgenic, so you don't lose your hair, you don't get puffy, you don't have the effect on the prostate. And I'm not kidding. So they came up with 3 drug classes: testosterone-derived steroids we have today. We have DHT, dihydrotestosterone-derived, and then we have nandrolone. We have NOR19-derived drugs. These is trenbolone and decadorabolin, Anadrol, Anavar, Winstrol. So you asked a loaded question. I think I hopefully just answered the question for you.
No, that was very clear, and I appreciate all the the details that you went into. Now, why would a physician today prescribe a patient with an anabolic steroid?
So let me go back to the old. So in the 1960s and 70s, the golden era. Let me go back, and I'll come from the 60s up to today. From the golden era of pharmaceutical production of anabolic androgenic steroids, which was the 1960s into the 70s, 50s to 70s, you produced, Bayer, Sherling, the big companies, the big companies. They didn't see it. This is like amazing. This is a drug used for helping people that are frail. Obviously, hypogonadism for men. Tons of women received it for inoperable and metastatic breast cancer. This is real. Anemia. This is like, because the side effects of the drug. So they're looking at, these are brilliant doctors and chemists and people in the community way back in the 60s and 70s and 50s. And they realized the different effects. And it was all, there were clinical trials, and there was tons of anecdotes, and people looked at it, and, Anadrol and all these different drugs. And then over time, so into the 70s, into the 80s, these drugs, they were used more for sporting, right? Now you can see what's going on. People catching on, back in the Schwarzwardian times, right? We won't go into Arnold. Back in the 60s and the 70s, people realizing, and the truth doctors, all the stuff, you see all the videos and all the things I'm involved with, all these men, are saying, including Ronnie Coleman, in the 70s and 80s, 90s, they received steroids from doctors.
Oh, yeah.
No, come on. Now, going to the 90s. So then, and this better than me, then the Fed came up with the 1990s with they made anabolic androgenic steroids a controlled drug. You will have to be very careful. Only doctors can prescribe. Now, during that time period, except for some cowboys, and there's still cowboys today we're going to talk about, prescribing steroids for muscle building. So that's what happened. Is that clear?
Yep.
That's what happened into the 90s. Now, then from the 90s to today, anabolic steroids, mainly testosterone, the old school Anadrol and Dianabol, they were very quickly removed from the pharmacies in America. And apart from some historian guys that will tell me this, this region was still using it. Okay, most pharmacies, it was only for muscle building, so they removed them. Okay, this is by the end of the 1990s, pretty much, and testosterone only esters. So only testosterone esters are around. There is some use of Anavar, really is oxandrolone if you're in a burn center, or if someone does have cachexia and AIDS. You hear about this stuff. It's really true. I'm involved with this stuff, with other expert doctors all over the world. So for wasting, for burns, for different types of malignancies and cachexia, where you're sick, someone has cancer and they're very thin, and you see that, but you have cancer, you're weak. So they're still used in limited circumstances. So that's from that point to now, you have just testosterone only now in CVS and Rite Aid and Walgreens, right? Retail pharmacies only for male hypogonadism. But now let's talk about this. In the outside of retail pharmacies in America today, I will ring a bell. I'm ringing a bell. There's a warning bell ringing. There are anti-aging and testosterone clinics that are working kind of not a gray zone. They're actually working wide open. They are providing some men they provide with legitimate hormone replacement, testosterone, that need it. But you and I both know that there is, because of this vacuum, because doctors are not involved, they're overloaded with everything, including primary care is really not around. And endocrinology doctors are too busy with diabetes. Urology doctors are too busy in the operating room doing surgery. That's what they do. They're not medical doctors, they're surgical doctors. There's been a huge vacuum in 20 years filled in this country with anti-aging facilities giving, in my opinion, mostly unapproved and really illicit steroids. They give too much testosterone. They give people testosterone who don't need it. They don't know the side effects. They don't look at the side effects like heart disease and prostate disease, not to mention worsening depression. Sexual function is going to be all over the board. Initially, it's good, then it gets bad. That's why these guys come to me. And they give extra drugs. They give Anavar. There's a doctor, I won't say who, in California who gives Anavar. That's a full-blown oral steroid. It's a massive, that he gives testosterone way too much. He gives Anavar and decadurobalin, wink, wink, for shoulder pain. These doctors, now they do lose their licenses from time to time, but they pop up across town. And you know who owns? They don't own their practices. Businessmen, and I'm sounding an alarm. I hope a lot of people hear this because, again, I'm not trying to wreck their business so I can get more business, wink, wink. This is the truth. Real doctors look at this and say, what the heck is going on? Anti-aging? Isn't anti-aging about living a great life and not having a heart attack or getting cancer? Anti-aging with steroids and growth hormone and anti-estrogens and aromatase inhibitor and Clomid and tamoxifen. It's completely so out of control. But they have attorneys and they function within attorneys, and they are functioning technically within the law. And if someone dies or has a heart attack or a complication, the patient or the loved one gets a lawyer, and that doctor loses his license or gets clipped back. I'm telling you the truth every day. Yeah. Half of my business today comes in from these, we call them shady testosterone clinics. I mean, they're all over Texas. They're all over California, Nevada, Florida. Every state has some of them, but Texas, and Florida, Nevada, those are the big states.
Yeah, and just like you believe, Doc, I mean, we believe education is paramount. It's key, right, to getting to people. And here at the Taylor Hooten Foundation, we educate young people and their adult influencers about appearance and performance-enhancing substances because we know 7% of middle school and high school kids admit to using. That's male, female, athlete, non-athlete, all included. And like any other illicit drug out there, right, young people are going to be tempted or pressured to abuse them. What are your thoughts when it comes to a young person, a teen, using anabolic steroids?
So here's the deal. So, of all my work, we get about 3 consultations a day online in the last 18 months or so. A lot of stuff's coming in. most of the average bear, I say, is two divisions. Testosterone replacement. That's going to be a guy who's in his 40s on testosterone. May have done some steroids, but he's just more of a businessman and he likes testosterone and he's at a clinic. Boom. The other side is younger men in their pretty 20s, 21 to 30. And they're coming to me on anabolic steroids from the underground. Okay. And some of them, interestingly enough, are coming from the testosterone clinics, which just that's part of the alarm. What 23-year-old man needs testosterone replacement, Don? That's just comical. Hey, you could do better. Your levels are a little low. You're 750. You can, how's your libido? Oh, my libido's great. Well, let's make it better.
Yeah.
So let's shut your testicles down and make it better. Okay, great. So shame on these places. So I have men, 15 to 17-year-old boys, men. Those are boys. I have them coming in. It's not just steroids right now. It's SARMs. Okay. Let's talk about SARMs, selective androgen receptor modulators, SARMS. This is a drug class that, again, came out of science 15 years ago. They're not licensed. They're not a real drug class in America, although there's a lot of politics on this. They selective androgen receptor modulation. So the side effects of steroids are known: hair loss, puffiness, hypertension, prostate issues. I mean, come on, acne, right? Mood disorders, on top of feeling great. For the lucky guy and for this guy and that guy. So it's a moving target and it's hit and miss. So there is going to be a class of drugs that you're going to see in America that's going to be legitimately utilized. I think for people that are older and frail, osteoporosis, someone's grandmother or mother that's getting older, and that's going to help her stay at home and function, right? So these are abused. So today, these are in the streets in not even a gray zone. There's just they're not depicted. They're not considered drugs. You know about this. You know that Orrin Hatch and a congressman from Rhode Island right now, there's a bipartisan push for a bill where they're going to make those illegal. Are you aware of this?
Yeah, I've been trying to follow some of the media on that.
So this is the new thing is these young guys. So let's focus on this. This is going to be for people to educate and understand. So if you have a young boy, 13, the youngest I've seen is 13. Young. These are I'm telling you, man, these are smart kids. They're on the internet. They're brilliant. Everyone knows that. Like, hey, you want your iPhone to get fixed or your computer, give it to your 15-year-old. So these kids are on there. The accessibility, they buy, everything comes in with FedEx and UPS. No questions asked. And I'm not criticizing our country. We have enough problems right now. They can't control it. Internet is wide open throttle. These kids buy it. They look at I do videos. I've done videos about this. I mean, I've been doing this for years. SARMs the young guys don't do steroids. Young teenagers, because they're, it's interesting. They're pretty protective. They don't, and of course, the young guys do steroids, but there is a huge I assume millions and millions of men in the world. They're young men. They're not men yet. Pubescent boys, teenagers that are, hey man, like I'm on the blogs, I'm reading this stuff. Everyone's learning. Hey, Doc, I did my research. Oh, what was your research? Oh, I've been reading on the internet for a year. Oh, okay, that's your research. I mean, that's just what it is.
Yeah, it is.
So then SARMs, they buy, and not to mention, because the doctors don't have a clue, which I love these doctors. I'm a primary care doctor by trade. I need to contact more. We got to educate these doctors. SARMs, they're buying SARMs. Laganvol, Rad 140. Please see my videos on my YouTube. Look at the comments. Hundreds and thousands of comments. Unbelievable. These men are, everyone's, one good thing about this era and some of these young guys, they tell it all, Don.
Yeah. They want people to hear them.
Correct. They spill it right out looking for help. So these men are coming in, the young, my teenager consultations, which I never work with teenagers because I'm an adult internal medicine expert. So I'm working right now with other doctors in Boston, Philadelphia, Los Angeles with pediatric endocrinology. I won't say names, but I'm working with them right now because I do the consult with a parent. always with a parent because they're under 18 years old. I've done many, dozens, and more coming. And I'm very careful. I listen to them. And because the young man, I keep saying young man, the boy is very respectful for me because I'm the anabolic doc, and he's been following me, and they're so happy that I'm listening and I'm discussing what they want. And, but I have to be very careful that I'm not giving any indication that I'm supporting this, right? It's a very hard walk sometimes.
Mm-hmm.
I'm not abusive. I'm not disparaging. I listen, but I clearly, my average guy that I treat is 27 to 40, 27 years old to 35. He's already on steroids for 5 years or 10 years. How do you like that?
Yeah. That's
my average anabolic recovery patient. And then my average TRT patient is just unhappy with his medical care. And he otherwise is happy on TRT, but he's going to have a heart attack potentially. He's like 45 to 65. Yeah. So those are my two divisions. It's crazy. It's just a crazy time.
Yeah, and that's a great transition because having watched many of the videos that you put out on YouTube, which are great, by the way, and we're going to talk about that. And I want to place also a link in our show notes to check those out. There's always a common theme in your videos, and that's heart disease. What is heart disease, and why are you so concerned about it?
So you got to see where I come from, right? So I'm a board certified academic internist. So you don't even know what that is, probably. Internal medicine used to be the foundation of primary care, and general internal medicine was every cardiologist, pulmonologist, endocrinologist, rheumatologist, nephrologist, infectious disease expert. What am I missing? Gastroenterology. All those doctors, did you know they're internal medicine doctors? We all start with internal medicine 3 years after residency, after med school, and it's a browbeating. It's really incredible how we are trained in the country. It's all over. It's over. And I don't want to go into politics. It's sad. So they've streamlined it. They cut it down because primary care is over and there's all walk-in clinics. There's some primary care doctors around, but the numbers are just dwindled to nothing. So I'm a primary care doctor. What do I do in primary care? Hypertension, diabetes, cholesterol. What does it end up? And people are overweight in this country. Heart disease. So every person has, number one cause of death in America, is heart disease. So everything I look at, and before I went to med school, I was on a PhD fellowship at New York Medical College to be a scientist. A PhD is obviously not an MD. I was on a fellowship to be a scientist, and my research interests were, how does heart disease occur? What is heart disease? Endothelial how does the plaque? So you see, the moon's lined up. I loved exercise and heart disease prevention. I became a general practicing internal medicine doctor, not a cardiologist, because cardiology doctors see their patients already have heart disease. So I thought I would be a good internist and I would prevent heart disease, and I did, and I still do. And now I'm working with men on steroids. Okay, anabolic steroids, if you look at the data, definitely, including even testosterone man per man, can lead to worsening existing heart disease or creating heart disease. No one's going to argue. It's very controversial. People get very defensive. Men get very defensive, and steroid users get defensive because it's like telling an alcoholic you can't drink. You're going to have, you're going to get hurt. You're going to lose your job. No, I'm not. So it's like, I would be very careful. When you take steroids, think about the common sense. You get puffy. Your blood pressure can go up. If your blood pressure goes up chronically for years, I don't care if it's from eating at McDonald's or too much salt, you're going to be at risk for a heart attack or stroke. Am I right? I'm right.
Absolutely.
Okay. Next. Steroids are notorious depending on what steroids are. This is why the stuff doctors need to be, I'm educating physicians on the technical side of this stuff. Anabolic androgenic steroids, depending on oral steroids, intramuscular steroids, what steroid type, mixes, stacks, will have debilitating effects on the cholesterol panel. Cholesterol is one piece of how people we produce blood clots and more appropriately plaque, gunk, and build up in your arteries. Remember, number one cause of death, heart disease. No doctors around. There's no primary care. They're overloaded. Cardiologists are waiting. Once you get that stent placed or that bypass, they're going to be your doctor. It's too late then. I mean, then it's just nailing down the hatches the best you can, and you're going to feel crappy after a bypass surgery. That's guaranteed. Seems like no one really cares and no one really knows. So steroids, Dr. Bagish, I'm going to give you some evidence-based medicine here. Dr. Aaron Bagish at Harvard, Mass General, obviously a smart guy. He's interested, like me, on steroids. He's a cardiologist. He's produced some case studies and some literature, and more than case studies, looking at how steroids cause heart failure, which is not the plaque in the artery, can be from the plaque in the artery. It's how the left ventricle and the heart doesn't function well. And I have seen thousands and thousands of men with heart attacks, heart failure, death, dialysis. That's my bread and butter for the steroid guys. And
is that
some
what,
of them
is that what you would refer to as left ventricular hypertrophy?
So LVH, that's LVH, and left ventricular hypertrophy. LVH just no. That could be the beginning of it, but that could be just I mean, I don't know what the number is. I don't know that anyone knows the real number. America's overweight. More than half of America is pre-diabetic. And if you look for the echoes, if you do an echo card, I do all this. What these men pay for is I'm a concierge doctor. They pay a small retainer. I'm in network with insurance. I run a practice with expert managers and nurses, and I micromanage these men. It's primary care medicine they've never had, but I don't do I do executive physicals. Everyone gets it. It's about 2 hours. And then I have a laundry list of things we need to do. And my staff works with the men on getting it taken care of all over the country with other primary care, clinics and cardiology doing it. You see, I've been doing this for almost 20 years, so I do it. And I'm very focused, and I can't dilly dally. I have to move, but this is what I've created. So steroids definitely are gonna increase a man's inherent risk for having a heart attack, probably more than a stroke. Then it's all the guy. I'm okay. Why is this guy 50 and he's on steroids? No names mentioned. He's a pro bodybuilder, and you look at him and he's still walking around. His heart's fine. Okay, he's lucky.
Yeah,
he's lucky. What is your risk for gambling in Vegas? I say it's all about gambling in Vegas. Because how many men read the comments on my videos? Doc, I did have a heart attack, 28. Doc, my kidneys are damaged, 32. It's unreal. It's anabolic steroid, induced hypogonadism, where testosterone too early in steroids shuts off the brain. It affects the heart. It affects the prostate, the kidneys. That's my focus.
Yeah.
That's my focus.
That was actually, I mean, you almost led right into the next topic I wanted to discuss with you is, heart disease, obviously, that's the big one, right? We can't live without our heart beating. But what are some other significant side effects that a steroid user should be concerned about when they're taking anabolic steroids?
Well, here's what I do. Let's make it very visual. Let's make it, it's a great question. I'm asked this all the time. Let's imagine the poster that I know you do a great job, and you guys put out your educational data, and it's very, you guys are very accurate with your that illustration of the man, the side effects of the man on steroids. Let's talk about that picture. Let's talk about that picture. Everyone can understand this. I always go from crown to toe. Let's go from head to toe. Hair loss. Steroids are testosterone derived. They can absolutely lead to hair loss. They'll tear a man's trenbolone acetate, cattle tren. It's going to tear your hair off, buddy. If you like your hair, and if you look at the comments. So I did a video on hair, and I do obviously I do a very expert presentation about the mechanisms and DHT and all the different drugs that are used, minoxidil and Rogaine and all. So this is medicine. Hair loss. Let's keep staying in the head. Depression. Let's stay in the head, right underneath the hair. Brain. Depression, suicide, ideation, as you know from your brother, when they come off steroids. Anxiety, mania. If you have depression underlying, steroids are not going to be your friend. Not going to be your friend. You may feel great. you may feel great when you're on. This is why this stuff is so insidious, because you feel great. These guys mainly feel great. Why do you think it's a problem? It's kind of like booze. If you drink booze and you got sick, if you got, some people have a gene for disulfiram reaction, it's called. I think more Asian people, they don't drink so much, some of them, because they drink and they get sick. You ain't going to go back to the bar.
Exactly.
Okay. So you take steroids and you feel like a freight train. You feel high and your sex drive's up. This is why we're a problem. Okay, brain, and then you're going to definitely at risk for anabolic steroid induced hypogonadism, which you saw in my recent video. Which, it's so funny, that video is doing well, but it's not that sexy, and it doesn't have as many views as some of the sexy videos on steroids and some of the ones I did of the autopsy reports, which is approaching 1 million views. It's just comical. It's just so sad to me, But I have a group of people that love the science, and a lot of those are doctors in there, and doctors in training. So hair, brain, face, acne. It's going to definitely worsen. It could be deadly acne. And just to think you're going to go on Accutane, you imagine what I see, Doc, I'll take Accutane. You're going to take Accutane from the underground, not from a doctor, because you're on oral steroids, your liver is going to get damaged. I've seen severe liver damage and death. Accutane and steroids. You asked a question, Don. It's a very complicated answer. Yeah. We're still up in the head. Puffiness. Your face is going to get puffy. I have actors, no names mentioned. They like SARMS and Anavar and Winstrol. They don't like testosterone. Why don't they like testosterone? They told me years ago that we have to stay dry. What do you mean you got to stay dry? Well, Doc, we're actors. We have to look really chiseled on the face. Don,
can't get puffy.
Can you believe it? So let's keep moving down from that. We're out of the head. Let's move into the chest. Gynecomastia, itch tits. Yeah. Boy, this is a big topic. So you take androgenic anabolic steroids. They started realizing this back in the 50s and 60s. It's ironic and paradoxic that it's a treatment. Some of these drugs, across different classes, they're a treatment for metastatic breast cancer, but they're going to cause gynecomastia for men, which is lumps. And I have to differentiate. I've never seen a case, I'm knocking on wood right now, I've never seen a case of male breast cancer from steroids. I've had patients with male breast cancer because I used to be a primary care doctor, so that's rare. 1% of breast cancer is men, about 1%. Mm-hmm. So you take steroids, your body gets imbalanced, and with estrogen and prolactin and all these kind of different metabolites, very complicated. That's the whole complicated piece of this hormonally. And most men, depending on what they do and how much, what drugs they're using, their underlying body habitus, like, how's their body underneath, gynecomastia, big business, breast surgeons, anti-estrogen medicines, nightmare. Let's go from the nipples inward. Heart, that's my bread and butter, heart. I'm an internist. So anabolic steroids cause varying degrees of effects, can be very adverse for some people, certainly over time, cumulatively. The word is cumulative, doesn't happen overnight. Enlarging the ventricle, hurting the coronary arteries and causing coronary artery disease, heart disease, arrhythmias, atrial fibrillation. I've seen my share of ventricular rhythms. That's not good. That's death, sudden cardiac death. I've seen it. All depends on what you come into the trip with. What do you have as a medical history? And then you put it on steroids. Let's keep going down into the belly. We're into the belly, and we got a liver. If you're on oral steroids, these guys are brilliant. This is why doctors need to know this stuff. If you're on oral Dianabol, Anadrol, and some of these SARMs, it runs through. This is the first pass effect. This is the stuff in the 1940s and 50s. This is what they realized. So it goes through the liver, and the liver can get toxic, and you can get all sorts of issues in the liver. I've seen liver. I had a Saudi Arabian prince come 10 years ago to me after taking part of his liver out down at Johns Hopkins, and then he took his entourage up to see me in Connecticut, and it was amazing. That was an amazing consultation, because he was living on oral steroids, because over in that part of the world at that time, things have changed over there. He was scared to do injections. A lot of men don't want injections. They think it's going to be more toxic. So they paradoxically do steroids. You know this, right? They do orals.
Oh, yeah.
The oral steroids are paradoxically potentially worse. Okay, so liver, kidney, you got in the belly, you got a liver, you got a kidney, you got the guts. It can cause a lot of controversy on inflammatory bowel disease. You ever hear of that? You know what Crohn's disease is?
Oh yeah, my neighbor's got it. Yeah.
So if you look for the historical stuff, there's a lot of bodybuilders, you know, have had Crohn's and ulcerative colitis. And again, I'm an expert internist, so this is gastroenterology. This is my wheelhouse, right? So we don't know, because what do they give? What's one of the medicines that you get when you have flares in the beginning? Corticosteroids, prednisone, and that's a whole other thing. So, you know, why would steroids worsen that? We don't know. I know, you know, I'm doing a lot of research on blood disorders with the polycythemia and all this. There's going to be all these molecular fingerprints that are triggered. You know, this is the PhD level stuff. I'm the guys I'm working with, scientists all over the world. So this is really, really complicated. So the guts can get affected, but yeah, typically not. People get, you know, if you take a lot of androl, I've worked with many, many professional strongmen, no names mentioned, and they love Anadrol, Anadrol 50, A-bombs, testosterone, a lot of testosterone, a lot of Anadrol, a lot of good genetics, a lot of food, a lot of hard work. That's it, professional strongmen, all of them. It is what it is. Guys, sorry about it, but it is true, and their hearts get enlarged, and it's sad. And they look at early heart failure, and it is what it is. Seems like no one really cares. It's worth it for me, Doc, as long as I go to the world level and I'm all set. Man, ooh, it's a high. Remember, it's a high, just like skydiving or, you know, NASCAR guys. You got to be honest with that. We got to be honest. NASCAR guys, that's a high too. Yeah. NASCAR's not dangerous. I have some NASCAR guys. That's not dangerous. Okay, so it just being objective. So liver. Kidney. So anabolic steroids cause a classic condition called focal segmental glomerular sclerosis. Woo! FSGS.
And that's a mouthful.
Been working with Columbia University and Leal Hurwitz, who is the chief nephrology pathologist at Cleveland Clinic. She's a sweetheart, and her and I have worked on some cases, and some other doctors at Columbia University in New York City. I pipeline them when I see kidney disease from steroids in different stages, from early where I could see it's happening and we could help them really reverse it and stabilize it. I have hundreds of men in dialysis, and there's super famous guys, no names mentioned, that are in dialysis, and they've had kidney transplants, some of them too, because they continue to use steroids because it's such a psychiatric disease. This thing is, you know, the body dysmorphia. So kidney disease, heart disease, liver disease. Let's keep going down. Let's go from the abdomen into the pelvis. Testicles. I told you, testicles are going to shrink. You're a young man, your testicles are shrunken. Ooh, that's the anti-aging places they give all these crazy drugs like human chorionic gonadotropin and Clomid and all this kind of garbage. You know, there's no data to support the use of this stuff, and it works variably. But in the end, my opinion, because I've been doing this for 15 years, 24/7. It makes everything worse. There's no data, no support. Harvard guy, Bashane, there's no support. He doesn't even know about this stuff. He doesn't really know about post-psychotherapy. He's a good guy, though. Good guy. The guy down there, Baylor, he knows a lot about it, Dr. Lipschultz, but it's just like they're not in the streets and they don't know, and no one knows. But no one's seen more patients than me. I've seen over 5,000. So in the end of the day, your testicles are going to shut down. You're going to be infertile. Oh, you're young. Young men are freight trains. You come off. It comes back. Take HCG, Clomid, tamoxifen, aromatase inhibitors. Take it all. Go for it. On, off, this, that. And guys, in the end of the day, stay on testosterone, blasting and cruising because they feel like garbage. And who wants to feel like garbage? So they just stay on. Cross this line, Don. Cross this line. Keep coming at me. Boom, on testosterone forever. All my guys that come into the anabolic recovery, they're all coming to me on testosterone from the underground. They're just injecting it themselves for years. There's no doctors in there because they're just. And these are. Come on. These are accountants, doctors, lawyers, musicians. I have musicians, professional musicians that are on testosterone because they started steroids and they blew their balls off. Yeah. Let's go from the testicles backward. It's called a prostate. every man has a prostate. If you live long enough, you're going to probably have some prostate cancer. You probably won't die from it, though. I'm a primary care doctor, so I can make these statements. You take testosterone. Remember, I told you Dr. Ziegler, the Dynabol in 1950s.
Mm-hmm.
He saw the Russians injecting suspension testosterone, and he said they were catheterizing themselves in the Olympics in some training Olympic. This is Olympic weightlifting back in the 50s. I don't think I'm not calling the guy a liar. He's obviously passed on a long time ago. But it's like men take tons of testosterone drive steroids. They're so young, their prostates are fine. But you take testosterone for 20, 30 years, you're going to have, you ever hear of BPH? You know what that is? BPH?
What's BPH?
Benign. You don't know what it is. That's a good sign, sir, because you're a 40-something-year-old man. You know, see that? See, that's part of the history. So benign prostatic hyperplasia. Talk to your old man. He knows what BPH is. Oh, he knows what it is. So every man's going to have some degree of BPH when he's over 50 to 70, 75, 80. And it's a bear. It's an enlargement of the prostate. And, you know, ain't no 55-year-old man pissing like an 18-year-old.
Yeah.
I'm just telling. So that's your prostate enlarges. Anabolic androgenic steroids, including even just testosterone replacement, guaranteed it's going to affect that prostate. It's a slow-moving animal, though. When you're 23, do you think they care about they don't even know what the prostate is. When you're 23, do you think they care about their heart?
Yeah, you don't think about that stuff.
So let's drop under the testicles and the prostate into the legs. Ankle edema. Now, ankle edema, so these guys can get ankle edema because back up in the liver and the heart and the blood pressure, they're puffy. So I'm done. That was the head to toe. Was that pretty thorough?
Oh, that was very thorough. And I know you're on a tight schedule today and appreciate all your information. One of the things I want to make sure people go check out is your YouTube channel. I mean, you discuss PCT, post-cycle therapy. You discussed anabolic steroids, various types, all the side effects, autopsies, and so many more topics. And you do a great job of breaking it down. And we just can't thank you enough. I know you're extremely busy. You carry a very full schedule, especially right now. And I just want to make sure we thank you for the time that you've taken, you know, to spend with us on these 2 podcast episodes to share your knowledge with us. And I hope you'll be able to join us in the future for further episodes too.
Thank you so much, John. My bottom line word is, if this is getting out to young boys and young men, please, I'm begging you. It's not that sexy. Don't take any of these things. Go into skateboarding. You know, go be a BMX guy. You know, I know don't do it. Don't do a SARM. Don't do the ones. I mean, I'll just do one cycle. That's how it starts, Don. Exactly. We got to keep them off. And it's an upward battle, but you got to make them believe it's just not worth it. And if I know you're the master of education and you're doing what your dad created and now it's just unbelievable. It's phenomenal. So thank you so much. And let's keep doing some more work together. Thank you, Don.
Let's keep educating. Thank you.
Well, that's it for today's show. Thanks for listening to the All Me podcast from the Taylor Hooten Foundation, a nonprofit organization leading a national campaign to enlighten people to the truths about appearance and performance-enhancing substances and inspiring people to live and compete without the use of these substances. Please be sure to subscribe to our podcast and tune in to our next episode.